Okay, we can start. Okay. Good afternoon, everyone. My name is Ingrid, and I'm delighted to welcome you today to our webinar dedicated to oncology treatment. I'm the Administrative Director for Swiss Medical Gate in Geneva, and if you have any question related to convention, to invoice, payment, commission, please feel free to ask me afterwards. I will just, share a little sorry, I have it here. Okay. Just a few words about us. So Swiss Medical Gate is a medical platform that takes carefully in charge your clients from the very best step of your demand till the end of the patient's treatment. And due to this special virus situation, we have decided to start a range of webinars, and we would like to inform you that the next two ones coming up are orthopedy next week and cardiology at the end of the month. You will, of course, have other specialties coming on later, such as ENT, gynecology, gastrology, obesity, pneumology, and so on. And of course, if you are interested, like for today, you will receive the invitation to register. Nevertheless, we have two recommendations actually for today. We kindly ask you to turn off your microphone and your camera, so to avoid the surcharge. And if you have any question, please do send them via chat, and the doctor who was speaking today, they will answer after the speech. I will leave you now and let Dr. Rabaeus, our Chief Medical Advisor of Swiss Medical Gate, carry on with you. And I wish you a pleasant webinar. Thank you.
Faut quitter là, hein? De ton écran là.
Oui, faut que je retrouve la page, sorry. I'm sorry. Here we go.
Voilà.
Sorry, thank you.
So, good afternoon, everybody. My name is Michael Rabaeus. I'm the Chief Medical Advisor of the Swiss Medical Gate. And it's my great pleasure to be here today to chair the session which is devoted to which is devoted to oncology treatments. We will be listening to two speakers, Dr. Zouhair, who is head of the radio-oncology department of CLINIQUE Source in Lausanne. He will present to us how the clinic is, where it is located and how it is working, and show us some aspects of his work. And then he will be followed by Dr. Bohanes, who is one of the chief oncologists at the clinic. So I leave the chair to my friend Abdelrahim Zouhair, who will now continue his speech.
Thank you, Michael, and welcome and good afternoon for everyone. So I will start. I'm Dr. Zouhair. I'm the head of the Department of Radiation and Oncology in CLINIQUE Source in Lausanne. So first of all, I want to say that radiation oncology is a medical specialty that involves the controlled use of radiation to treat cancer.
Сейчас показывайте. Сейчас выводите.
I will give you a brief introduction about our CLINIQUE Source. CLINIQUE Source is
сейчас, okay.
the largest private institute
okay.
in the area offering multidisciplinary acute care.
Он не включил экран.
It's one of the oldest private clinics in Switzerland, founded in 1891. The clinic belongs to the Foundation La Source. is a private non-profit institution which also oversees the nurse school in Lausanne, Switzerland. So our slogan for our clinic is high quality services for your health. Our clinic resource is more than 150 beds. It's a private multidisciplinary clinic, and we have all kinds of multidisciplinary medicine, surgery, medicine, maternity, and located in the center of Lausanne. The clinic offers high quality services for our patients with highest level of safety and comfort, and is one of the part of the association of those Swiss leading hospitals. And also they have a nurse institute, one of the largest in Switzerland. The main medical and surgical specialties of our clinic is oncology, of course, robotic surgery, as Da Vinci, also Mazur for robotic neurosurgery, radiation oncology, radiology, gynecology, plastic surgery, etc. Now we start with the radiation oncology. Radiation oncology plays an increasingly important role in the management of cancer. More than 50% of cancer patients can expect to receive radiotherapy during the course of their disease. As the primary management, that's we call curative intent. We can treat cancer without other treatment, radiation, or in some situation we can suggest treatment for palliative care when patients have some pain or some bleeding. Radiation oncology in general is some team. Radiation oncologists as doctors, of course. Radiation therapists, we call technicians who give radiation daily to patients, and also radiation oncology medical physicists who check the machine and the control plan before to administer to patients. These highly trained medical professionals use advanced technologies to deliver safe and effective radiation therapy to cancer patients with a few side effects as possible. Is one of the important aims of our treatments. And we know from literature, from medical literature, that survival of our patients with cancer increased recently because one of important treatments is, of course, more advances in radiation technology, that cancer will be more cured now. The objective of radiation is to enhance a local and regional control of cancer disease. Now I will talk about the importance of radiotherapy oncology treatments. Radiation therapy means that we use high energy X-rays delivered by a machine we call linear accelerator. We have in our clinic from various medical systems from the United States of America. And there are different kinds of radiation. The first one we call external beam radiation therapy. That means we deliver radiation far from patients on the couch, and that requires multiple short visits to the treatment center for a few days, and normally from Monday to Friday for about 10 minutes a day. Taking some few weeks, depending which cancer, from 3 until 6 or 7 weeks. Radiation objective now is to minimize damage to healthy cells. That means we have to give the excellent technology and to focus radiation to the tumor and very sparing normal tissue to spare late side effect. We have another aspect of radiation we call systemic radiation, but normally used with nuclear medicine. That means that we introduce some radioactive chemicals into the body, normally oral from the mouth or intravenous injections, but normally it's used more with nuclear medicine, not for radiation oncology. Another treatment we call brachytherapy or internal radiation therapy. That means we deliver inside the body radioactive sources to treat in some situation, as for example, endometrial cancers or cervix cancers or prostate cancer, we can put some seeds on the prostate and you can deliver curative treatment without any surgery or external beam radiotherapy. Now we have a new technology we call radiosurgery and stereotactic body radiation therapy. That means it's some new treatment, new techniques that we give few radiation sessions, but with higher doses during few days. We can treat some brain tumors, for example, benign or malignant, some metastasis, or other lung tumor, for example, or metastasis, or different kind of tumors in the body. This new approach gives higher doses. That means that we have very excellent biology good effect and excellent results, and you can cure many small tumor in different parts in the body without enhancing any side effects. What is very comfortable for patients because it's very short and not longer. We have also very new treatments, mainly for left breast cancer for women. As you know, breast cancer, the left side is close to the heart. And in the past, we meet maybe many late side effects on the heart that cause some disease. While now, when you give radiation for all left breast cancer, we call deep inspiration breath hold. That means we also do the breathing of the patients, and we can give radiation only when patients stop breathing in inspiration, deep inspiration. That means the heart it's far from the breast, and radiation can go without any problem and any damage. It's one of very recent advances in radiation oncology treatments. Another one also, when we treat some brain or metastatic disease on the brain, we know that one of late side effects, they can have some neurocognitive deficits because it can cause some damage on the vessels. While now we can maybe spare some hippocampal area that we know it's a very sensitive area for the memory, and you can deliver radiation to the tumor while you spare this area, and you can give safe radiation without any late side effects. That's also very important. The last one, it's now we know that we have many cancers maybe very moved during radiation, as lung cancer, liver cancer, or metastasis. And we know if you want to treat, you have to add large margin around the tumor to target your tumor. But if you synchronize the breathing during radiation, that means you can organize that the tumor will be maybe on inspiration or expiration, on off, and you can reduce the movements during the radiation. And of course, you can deliver very high effective dose without any damage to the normal tissue around it. Radiation can be combined with surgery, with chemotherapy. We can give it alone, we can give it before surgery, with chemotherapy or with immunotherapy, with other treatments involved in cancer. And in some situations, we can deliver radiation as palliative when patients maybe can have some pain or some bleeding. I want to have some palliative effect to keep very high quality of life for patients. Now, radiation, of course, it's very personalized treatment. You have to define, depending in each patient with cancer, you have to prescribe radiation depending on, of course, the type of cancer, the size, the location. The cancer is localized disease or advanced disease? What is your intent to treat? Is curative intent or palliative intent? And which radiation to be used, and also to consider what is the general health and personal preference for patients also. The treatment is painless and similar when patients come to do some X-ray or CT scan. It's very fast. It's less than 10 minutes for each sessions. Before to start radiation, we have to do what we call dedicated CT scan. That means in the position of the treatment, we use some evaluation devices to be sure that it's exactly the area without moving the body. And we use also image fusion from MRI, PET-CT, for example, and you fuse this image to delineate very close to the tumor, and you can spare very normal tissue with high security. And after we plan the treatment with dosimetrists. It's one part of our team, and control with physics, and last with a doctor. And we finalize all the procedures, and we can decide to start treatment. Of course, we treat our patient with very nice new technology, as we use now, arc therapy for the mind treatment now. Radiation is good. They give the excellent results, but you have to be careful when you use it daily to be sure that you take all consideration safety treatment for your patients. While you have to have very careful monitoring during patient treatments. While in our team and my staff, every kind of team is responsible of step of patient treatments. That means, for example, when they arrive, we have the medical first consultation, we explain the treatments, we do CT scan, we do planification, we check if all the dose is correct to the tumor, you spare very well normal tissue, and you check with the medical physicist, all it's correct under the machine. And after we can organize to start in treatment on the machine. And when the patient come to start treatment, the machine now, the new equipment now, will have maybe we call con-beam CT. Doesn't mean we have some CT embarked on the machine that check before to deliver radiation. That means very safe treatment now, because all is robotic now. All is robotic. Last generation of course of the machine. We have all from various medical systems for United States. So of course, we have our internal meeting to check all these different steps during treatment is acceptable without any problem. If we meet some situation that difficult, we can share decision with my staff and other doctors. And also, all patients is controlled, have a checkup, medical checkup weekly to check if the tumor is well tolerated, is there any side effects, you have to give some medication or not. And sometimes they have also two treatments at the same time with chemotherapy or immunotherapy. And we have to share also our information with our colleagues, medical oncologists, for example, or urologists, for example. So what now give more comfortable to deliver radiation now, this we call image-guided radiotherapy. We use this kind of image daily to check if the position is correct, if the target is very in the right position before to deliver radiation. That's one of very important progress in radiation treatment recently. What is the future of radiation oncology and what is new in Switzerland? For me, I'm very lucky to work in our clinic because I have the opportunity to have all very large generation of equipments, and I have excellent radiation oncology team work together. Also great collaboration with our colleagues, medical oncologists and other doctors. And we use the last generation of technology and very advances to really benefit our patients of the best treatments. That means you cure higher patients with very few side effects, and you can shorten your treatment. And now we see now in the practice, and also to improve the quality of life of patients. The future, I think, very interesting to have more and more, I think, molecular imaging to show very small tumors to be more targets in our volume. We use more and more now functional imaging to perhaps to give in some area on the tumor, inside the tumor, some area we call hypoxic with less oxygen that need more doses, and you can, with this technology and the new tools of imaging, you can enhance the local control and you can more target your disease, and you can more spare normal tissues. This is the conclusion of my talk.
Thank you very much, Abderrahim. We have already a question, I see.
Okay.
Which is, now I lost it. Where is, there we are. I don't get, here we are. One of the participants asked you to be a little bit more precise on what makes Clinique La Source a better clinic than many others.
Of course, I'm working in Clinique La Source. I have a good it's one of oldest clinic in our area. We have all the new generation of equipment, and you know, it's the first private clinic to have robotic surgery all in this French-speaking area in Lausanne area. And we have excellent collaboration with the doctors, with the, in our tumor board to share all decisions. And we have the facility to access to all large generation of equipment in different medical fields. That means in radiology, in nuclear medicine, to have anything. We have our lab, and we have, I think, excellent clinic with nice beds to welcome to patients when they come to be treated. And also I think items it's very important to consider our clinic. It's one of the best clinic in Switzerland. And also with the longest story also, you know, it's more than 150 years old, this clinic.
That's what I was going to add. I think it's very important that we remember that Clinique La Source has a very long-standing tradition, and it is, if I may say so, very Swiss in the good sense of the word, very stable, and where everybody works always in the same direction. The patient's interest comes first.
Yeah, and also it's used as maybe public clinic because it's under foundation without any profit, and I think they put the health and the quality of treatment for patients in the first line.
Okay, it seems that there are no other questions for the moment.
Yeah.
So we will...
hello, doctor, it's Marina speaking. Just a few, Dr. Bohanes, could you please tell us your nickname? For your nickname. Ah, okay, you stay, okay, you stay it was, okay, no.
Oh, il vient là.
Hello, everyone. Do you hear me?
Yes, we hear you.
Perfect.
Well, I will then leave the word to you, Pierre Bohanes, one of the leading oncologists of the clinic. And we're looking forward to hear a little bit from you where oncology is going at present in the modern world.
Sure. So, yeah, let me start. Yeah, great talk by Dr. Zouhair. Let me just take a step back for our oncology department, Clinique La Source, just to show you our philosophy. Here at the Clinique La Source, really what we wanted is to kind of create a kind of comprehensive cancer center, like a small comprehensive cancer center, but not in the way like usually US means, so only research, basic research, clinical research, everything for research, but really focus on the patient. So comprehensive in the sense of the patient, and put the patient in the center of our clinical care. And for that, we are lucky that we have a lot of very skills and trained specialists. And this is really our concept. So small teams with highly trained specialists that are used to work together and try to really minimize all the, I would say, staff in training, which is not our goal. We leave that to the university hospitals. Really, our goal is to give the best treatment to the patients. And so if we go back to our clinic, so here we are, I would say 6 skilled oncologists. We have as well some hematologists. And of course, we have a close collaboration with other specialties like radiology, radio-oncology, surgeon, urologist, and we have really a team that we built, a team that is used to work together. In order to, to coordinate that, I think one of the key points is to have a multidisciplinary tumor board. And this is really what we created, a space where we're discussing all the cases, and we're trying with the patient that has to be seen by all of the specialists. We try that, and so we discuss each case and what is the best option for the patient in that tumor board. And I'm lucky enough to be the director of this tumor board. And this really works fantastic, and is a very, very, very huge consideration for the patients. Now, if we move to what we're doing here, in Switzerland and most of the clinics and the hospitals have, we're lucky enough to have access to all the very innovative drugs and immunotherapy. So we have that. We have access to all the new drugs, immunotherapies. We're combining chemotherapies and immunotherapies. But I think one of the key things that we move forward and that we have really great results, it's really trying to integrate the focal treatments and the systemic treatments. And this is really one key point. And we're lucky to have all these fantastic specialists like Dr. Zouhair or the radiologist, the interventional radiologist, that we try to really have a focal treatment, try to really kill part of the disease, and then give systemic treatments to increase the effectiveness of our treatments. And this is really what we have. We truly believe that this is the way forward, combining systemic and focal treatments. And this, what we've learned, and this is easy to say, but it's very difficult to do it in practice, because you need really trained MDs that are used to do that. And a good machine is fantastic, but if you don't know how to drive it, I mean, a machine is just a machine. You have to drive it. And this is what we have here, and the trained specialists. Now, another point is what we're seeing is the oncology has changed. It's changed. Now we don't have one single cancer. You don't have a single lung cancer. You have multiple lung cancers. And our goal is really to define a molecularly defined cancer and give the right treatment to the right patient at the right moment. And this is what really we're trying to do. Of course, taking care of the patient. So that's why we really want to see the patient, because I will not give the same patient to the same treatments to all patients. I really need to individualize that based on the patient. But then, of course, we need the molecular aspect of the cancer, and for that we're working with our colleagues pathologists and their molecular tests that are getting better and better. And really we try to find new targets, combine the drugs based on these results. And this is what we see. If I move forward with the third point, the second opinion, this is what we're seeing. We're very lucky to give the second opinions and review all of the files of the patient. But often what we're seeing is that we're missing all this molecular aspect of the cancer, which I believe is truly really important at this point. So here, what we like to do when we give second opinion is, of course, review the patient, review the file of the patient, and try to integrate all of the data. That unfortunately, too many patients are doing, exams at different places, and no one is really taking the time to put all this together. And we're doing that at our multidisciplinary tumor board, and then we're trying to integrate all these molecular aspects, and of course all the regular stuff like the labs and biology, the regular thing. So let me finish by giving some practical consideration for what we like to do at Clinique Source. When we're seeing patients, what is really important for us is to review the images. And this is often a problem because the patients come with, you know, some USB keys when it's very difficult to open it, and half of the images are missing, or, you know, you have on the cloud, and then it's very difficult to download these images because, you know, sometimes our informatic guys are very reluctant to do it because they are afraid of viruses. And so what is really important, if the patient can really get the CD with everything, the radiological exams that have been done, so we can review that. If it's not possible, we're very happy, of course, to do again the exams and read that. And the second point, if the patients, when they're coming and see us, if they can come with the blocks of the pathology, not only the pathology report, but the block itself, so we can review it by our pathologist, because this is unfortunately something that we see is the training of the pathologist and his, I would say, knowledge of the specific disease, which is getting more and more difficult, is very important. And so we like really to review the diagnosis, and so we can review the blocks. It's faster, cheaper, and then we can also do all these molecular tests that I was talking about. So this is a bit our philosophy of the clinical last source, and so I will leave it here so we have a bit time for discussion. Thank you.
Okay, thank you very much, Pierre. Voila, now I'm back also. And I very much appreciated your presentation. I think one of the things that I do personally would like to underline is the fact that you insisted on the fact that there is a tumor board, that you really have everybody discuss the case. And I think that's something very important for the patient. And there are some questions from Mrs. Tatiana Sokolov. She asked, do you use therapy by dendritic cells?
No, at the moment, this is a very investigational approach, all these dendritic cells. I think, you know, all these immunotherapies is very exciting. Unfortunately, you know, I think at this moment, it's missing some truly evidence that it's working in most of the diseases. There are signs in some diseases, but here we don't do that. We're really focusing on, you know, immunotherapies with all the antibodies and combining them, and as I said, with the focal treatments. That's our approach.
I think that's, I'd like to underline, I think that's one of the approaches that is very important, that one does not immediately adopt new therapies just because they look nice and etc. Because we sometimes, as you know, we have had bad surprises sometimes. Then, yeah, that was the same question by Natalia, what kind of immunotherapy you use? Well, that's what you answered more or less.
Yeah, I think, you know, I will underscore what you're saying about immunotherapies. You know, they're huge interest and huge, but now everyone is doing everything and is calling it immunotherapy. And it's not because one form of immunotherapy worked with the antibody that all forms of immunotherapy will work. And now you know, I think interest is good, but I think we have to go back to what is working. And I personally think that my goal today is not, I'm treating patients. I'm not treating mice or guinea pigs. So I will really give things that I know that have been demonstrated to work. And then we can discuss how to increase their effectiveness. And that's what we're doing. And we're not trying to do research on patients.
I would like very much to underline what you just said, because I think that is exactly what I call practicing good medicine, because we want to treat the patient the best way. And that's the important thing. And the patient comes first, as I said many times already, and that this is the important thing. So thank you for that intervention. And there is that's somebody called iPhone, just ask us if we can put some of this information on by writing. I think we could do a little short thing. That's not difficult. So that will be the role of the ladies who are in charge of our society, that they will press us hard to write something down. Are there any other questions? Apparently not. So it was very nice. I like this very much. And thank you very much. I'm looking forward to seeing you soon again. And thank you.
Thank you very much.
Spasiba, everybody. So we will be, this was very nice. I hope everybody appreciated, and we will indeed try to give a solution.
Mm-hmm.
Oui?
Ingrid?
Yes.
Yes, could you just finish our webinar and also
Just
few words about the next Tuesday?
Okay, sure. Well, I'm just gonna put, if you want, the lines on. So I would like to thank you everyone for your interest. And as I said previously, we have next webinar regarding orthopedy, which is going to be held on the 21st of May. And then the next one is going to be held on the 28th about cardiology. And actually, Dr. Rabaeus will talk himself during that webinar. So if you are interested, you will receive anyway the invitation as per next week. We try to do it just a week, the same week that the webinar is on. And you just register as you did today. So we thank you for your interest. It was a pleasure to meet and know everyone in this way. And we'll hope to see you back in online pretty soon.
Hello?
Thank you very much.
No, just a few words about the, I will say in Russian, because I saw it, you have...
There is quite a few Russian, yes.
Russian speakers. Уважаемые партнеры, дорогие друзья, была очень рада всех вас. Я вижу очень многих людей, с которыми мы знакомы. Мы проводим эти семинары для того, чтобы вы познакомились с врачами. Я понимаю, что это не такая форма, как личное присутствие врача, но тем не менее, мне кажется, что это полезно для тех, кто хочет дальше продолжать с нами работать и таким образом хоть как-то немножко узнает врачей. Следующий наш семинар будет посвящен ортопедии и только бедру с ревматологией. Вместе связаны всегда два врача, и будет представлена впервые клиника Латур. Будем вас всех ждать в четверг. Вот, если у вас будут пожелания, вопросы и так далее, пожалуйста, пишите. Thank you very much, everybody. It was very nice to see you. Thank you, Ingrid. Thank you, Dr. Rabaeus.
My pleasure.
Yeah, see you later.
Thank you, thank you.
Okay, ciao, bye.
Bye. Have a nice afternoon.